Hi everyone, India from Wig Medical here. I am so happy you joined us on our channel. Today, we will explore how nutritional deficiencies affect hair loss. Don't forget to like, comment, and subscribe to our channel for more videos on medical-related hair loss. Healthy, vibrant hair is often considered a symbol of vitality and well-being. However, the condition of our hair is not solely determined by external factors such as hair care products and styling techniques. Nutritional deficiencies can also significantly impact hair health, affecting its strength, thickness, and overall appearance. Today, we're going to talk about the role of nutrition in hair health. Hair follicles are highly metabolically active structures that require a constant supply of nutrients to support their growth and moisture. Key nutrients involved in hair health can include vitamins, minerals, proteins, and essential fatty acids. Deficiencies in these nutrients can disrupt the hair growth cycle, leading to hair loss, thinning, dullness, and brittleness. There are a few common nutritional deficiencies that are associated with hair loss. B7, or biotin, plays a crucial role in the synthesis of keratin, the protein that forms the structure of the hair strands. Deficiency in biotin can lead to both brittle hair and hair loss. Next is iron. Iron deficiency, often associated with anemia, can impair oxygen delivery to the hair follicles. This leads to decreased hair growth and often increased shedding. Zinc is involved in DNA and RNA synthesis, which are both essential processes for hair follicle cell proliferation and hair growth. Those with zinc deficiencies can result in hair thinning and impaired hair growth. Next is vitamin D. Vitamin D receptors are present in hair follicles, and adequate vitamin D levels are necessary for maintaining hair follicle function. Vitamin D deficiency has also been linked to hair loss as well as alopecia. Omega-3 fatty acids also play a role in maintaining scalp health and reducing inflammation. Deficiency in omega-3 fatty acids may also lead to dry, brittle hair and scalp conditions such as dandruff. Now, let's talk about symptoms of nutritional deficiencies related to hair health. Hair health may manifest gradually and vary depending on the severity of the deficiency. Common side effects include increased hair shedding, thinning or brittle hair, slow hair growth, and changes in texture. These symptoms, however, can also be indicative of other underlying health conditions, making it essential to consult a healthcare professional for a proper evaluation and diagnosis. Next, let's talk about addressing nutritional deficiencies for optimal hair health. Maintaining a balanced diet rich in essential nutrients is crucial for promoting healthy hair growth and preventing nutritional deficiencies. Incorporating a variety of nutrient-dense foods, such as fruits, vegetables, lean proteins, whole grains, nuts, seeds, and even fatty fish in your diet can help ensure adequate intake of key nutrients essential for hair growth. In some cases, dietary changes alone may not be sufficient to address nutritional deficiencies, especially if the deficiency is severe or long-standing. In such instances, supplementation under the guidance of a healthcare professional may be necessary to restore nutrient levels to optimal ranges and support hair health. Nutritional deficiencies can have a significant impact on hair health, affecting its strength, thickness, and overall appearance. By understanding the role of essential nutrients in the hair growth cycle and recognizing the sign of nutritional deficiencies, individuals can take proactive steps to support optimal hair health through a balanced diet and, when necessary, supplementation. That concludes our video today. I'm so glad you joined us. Don't forget to like, comment, and subscribe for more medical related information. Until next time.